of substance use in our schools and in the environment. So the main problem is implementation. So these are my reference, and thank you for listening.
Thank you, Dr. Hazida, for your research regarding your topic. The floor is open for few questions. Any questions for the speakers?
Or contribution. Questions or contributions? Okay. Thank you.
So thank you very much for the presentation, and we apologize for this third lecture. Anglo-Arab, and I would like to ask to thank you also, because we have heard about the Nigerian advancement in the field of documentation of addiction, and this is something like that looks to be really promising. And I would like to ask you, have you, this model of focus group and work for the community, is it well known and well applicable? Have you been through this for long, or it's something that's just new in your country?
These days, I'm also doing my PhD. So these days, a mixed method is used in most studies, especially in community studies. But this is a facility-based study. And in facility, you have very few patients that are in admission. That's residential treatment program. So taking sample size from the community, that would be a community study. But this is a facility-based study with targeted needs. So we use focus group discussion because this is a new aspect, of course. My professor accepts focus group discussion so that you can get the person's view. Yes, you can get information from those that are having the issues at hand. Yes. So you can get the first-hand information that now can be used for analysis. So this is a qualitative study, it's not a quantitative study. Yes. But we made it a little bit semi-qualitative, semi-quantitative in the form of introducing a social demographic questionnaire to take some information from them, and then the list of discussion. We have a list of items that are left open for discussion, and we record whatever that is being discussed, either on radio or on how to give the respondents papers to answer if they can. There are some that are literate and there are some that are not literate. And there are some that will say, okay, I know of the risks, but I don't want to talk. And say, no, I'm so scared of that, that's why I came for rehab. This response is at the end. Sample size is only 55, showing that we have, over the 3 days of the study, we have only 55 persons in the inpatient treatment or residential center. In most cases, you don't have more than 100. You don't have more than 10. But we are able to get 55, and it's a good number. Thank you very much.
Thank you very much. And I would like to emphasize the importance of using qualitative studies and focus groups in our countries for not just importing the results and of the already done, because this is a new area and the exploration should be there, and the way is probably focus groups would help much. Thank you very much.
Thank you so much for this fascinating presentation. I think I have been in Norway for 5 years, and then after your presentation, I discovered why they put in the board of the hospital a lawyer to be involved in such law-related issues. But my question is, we are speaking a lot about the law and how to be informed, but I think we need, because now we have a conference related to the university and the teaching and education, we need to put something in our curriculum for doctors to be from the early beginner, as early psychiatrists and meet psychiatrists and later on, to put a very oriented law curriculum for medical purpose. Because I think we are to some extent ignorant of many of this law and the advancement and the development in law. I think that's very important.
It's very, very important that physicians, basically all physicians and especially psychiatrists must be familiar with the law. And at the first paper in the international textbook of forensic psychiatry, they say that psychiatrists must be familiar with the law, because law and psychiatry are two faces of one coin. So وده حصل في مصر في الفترة الأخيرة إن النيو ميديكال ريسبونسبيلتي لو make a great awareness among psychiatrists and physicians about their rules and their responsibilities, حقوقهم وواجباتهم. النقطة دي ما كانتش مدركة قوي، ما كانتش الفيزيشن والسايكاتريست انسايتفول قوي عليها، بدليل ان في خلال ال10 سنين الأخيرة او في خلال ال12 سنة الأخيرة حكاية الاليجيشن اوف مال براكتس كترت قوي في مصر. تمام. فالميديكال ريسبونسبيلتي لو هيدي الاويرنس دوت للفيزيشن والسايكاتريست، بس هو ستيل رايت ناو مش بيتدرس في الجامعات المصريه ولا في كليات الطب، ولا بيتدرس في الكوريكولم بتاع الفورنسيك سايكاتري، ولا بيتدرس بتاع الكوريكولم بتاع الفورنسيك ميديسن في سنه رابعه في كليه الطب. فده طبعا جود ريكومنديشن ان الميديكال ريسبونسبيلتي لو will be studied in the curriculum of student in the fourth في سنه رابعه طب في كليات الطب المصريه.
Thank you, Dr. Ibrahim. I think so just for the English speaker, just to translate what Professor Ibrahim said, that it should be one of the recommendations of this conference, hopefully, will be to introduce the medical responsibility law in the undergraduate student and postgraduate, so that the doctors from the early beginning should be familiar with law as a part of the practice, because this is very important. I think this is the summary. Thank you.
شكرا جزيلا على الحضور، ودلوقتي في كوفي بريك for half an hour. شكرا.